going to talk today about what I think are the 4 main barriers to patient engagement and the ways to resolve them. So the first one is access to information. So the first thing is patients just need access to their own information, and not just bits and pieces of it, but all of it. So I'm not sure if you've ever tried to get your medical records from somewhere, but it's actually a pretty difficult process. There are all these different forms to fill out, and they're all different. So every different doctor, every different health system has a different looking form with different questions on it. Most of them make you fill it out in person. Some require a notary. And if you can do it electronically, they usually send it to you or have you download it from their website. But you have to be savvy enough to print that out, sign it, and either scan it or fax it to them, which most patients just aren't really that savvy to do that or really have the desire. So the first thing is that. Now it is getting better. We're starting to get all these patient portals where they give you access where you can just log in and start to look at your information. So this is one of the examples of the logins from Morgan's patient portal. And as you can see, we've gotten quite a few of these. So this is another one. This is another. It looks like the first one, but it's really not because it's a different health system. So when we log in, they look the same, but they have different sets of information. There's another one, and another one, and another one, and another one. So she's up to 7 patient portals at this point, all with different stories in them. So we really have to get to the point where patients have all of their information, and it's really not that hard. It's a difficult, all of these have different password requirements, so I can't even use the same login and password. So it's hard to remember all of that information. So the next thing is meaningful information. So getting access to the information is great, but I like to carry this prop around with me even though it's heavy in my suitcase. This is 1 year of one doctor's record for Morgan, 1 year of one doctor. So you can imagine trying to look for something in this if they ask me for a test result. It takes me a long time to find that. But it's not just me. The doctors get this information. Morgan's pediatrician actually asked me to stop listing him as her pediatrician because he gets so much paperwork from all these other doctors and he can't process it all. So, it's just too much. So we need to start figuring out ways to display it in a meaningful way. So as an example, when I logged into one of Morgan's patient portals, here's her lab results as the way they display them. So it's in a list view. It gives the normal values and the range. But for example, her SED rate has stayed high. But when you look at it on a graph, you can see that even though it's still high, her SED rate climbed, but then it came back down, and we've had a few spikes, but it's definitely trending downward. But if you just looked at whether it was normal or abnormal, that wouldn't have really told the whole story. But looking at this, you can see that it actually is trending in the right direction. Another example of documents, you can just look at documents one at a time, but on the right side, there's a timeline view where you can actually view the information in a medical timeline with summaries of bits and pieces of the information, just the important parts. And you can filter that information. So if you're just looking for information on she had meningitis twice in the last year, and the second time I could actually filter and show them exactly what happened the first time, what they did about it, and how to treat it. That's a lot harder to find in a stack of information than it is in a filterable list that I can share with someone. And then some of this gaming that's coming out is really helpful. So this is a medication tracking app. So it can kind of give you encouragement that you were perfect and you took your meds, or oops, you've missed some on these days. And so it just starts to put the data in a new perspective. So it's making that meaningful instead of just, asking how are you doing with your meds, and kind of gaming that a little bit. So the next barrier is collaboration. So as you can imagine from my story so far, Morgan has a lot of doctors. So these are just a few of them. She has some specialists at All Children's Hospital. She has 2 gastroenterologists in different states. She has a primary care doctor and a rheumatologist. She gets most of her care at one hospital, thankfully. She has specialists at a different health system in Tampa. She sees 2 super specialists in different states. And then she has a school nurse and a physical therapist. So that's a lot of caregivers that all have different healthcare systems, different EMRs, and they don't really talk to each other on a daily basis. But on top of that, she also has a lot of other people in her care team, her parents, her siblings, her aunts and uncles, her grandparents, and even the CureJM network that we found. So it's really important to give different ways to collaborate. So this is one of the examples on the CureJM website. There's a message board where you can post, and other parents who live with this disease and helping manage their child every day, they can go and get help from other parents who have real day-to-day advice and help. Here's an example when Morgan got meningitis as a side effect from her IVIG treatment. I posted this online on our private Facebook group, and within 2 hours I had 56 responses from other parents telling me, when my child had this, this is what happened, and this is what you can expect. And I was able to take some of that information back to her doctor and share what's happened, because he only has 4 kids that have her disease. It's not like he's had a lot of experience with this particular issue. So it's been really helpful. And then the last barrier is communication and convenience. So I think Carly stated it really well this morning on stage, that she said, I have a full-time job and I have a full-time unpaid job as a patient, and I don't have time to be going around to all these different systems to do all these different things. So we really have to make it convenient. We need to make it easy for the patient because they're already struggling with enough. So this guy is really what I feel like a lot of the time when I try to interact with the healthcare system. I get all these menu-driven buttons, and it's one thing if you're just trying to get something that you have a few days' time, you can wait. But if you're trying to get help with something pretty quickly or an answer immediately, or even just in the few minutes you have at work or something to make a phone call, it's challenging. So things just simple like messaging and email and making it easy for that. And then I like to say, meet patients where they are already. Use the tools that they already like to use. Like if you can allow text messaging, I know it's a controversial subject, but things that are simple, you know, that you can allow people to do, and including social media, that's really helpful. So to summarize, the main barriers are to remove those barriers is to provide easy access to all of their information, not just some of it, not just their medications or their problems, but all of their health information. And then make that data meaningful so that they can actually use it, not just the patient, but also their family and their providers. And then provide ways for people to collaborate around that information and make that convenient to the patient so that it's easy. So just to step back a little bit to the beginning of the story with Morgan and her diagnosis, I later found out when I got all of her medical records that the biopsy from her tonsillectomy that she'd had when she was 6, 5 years before she started having any problems, said investigate autoimmune disease, but nobody ever told me that. Nobody ever told any of her doctors that, so nobody was aware of it. I found out that just because we were lucky, we got all of her tests the day before she went to camp. But if she had started her steroid treatment and then had the test later, we would have never had a baseline MRI from her disease. So there are a lot of things that happen along the way, and you have to learn to engage and get people, you know, the help that they need. And patients that are engaged can get better care. Thank you.
And we'll take a few minutes for questions. Have anything that is sort of commentary, more than a few minutes, we ask that you hold them discussion. We have about 3 other speakers that want to speak. We'll take questions right now. So I actually have a question for you, Amy. So tell me about just sort of an eyeball estimate, just from your experience. Mom, who's trying to work, who's trying to balance family life, trying to balance all these things. Can you give me an estimate, just in your experience, how much money you probably saved yourself in keeping all of these things organized compared to something like this? Just an estimate.
Sure. So I know that we've avoided having at least 4 MRIs because we had the results ourselves. So those are pretty expensive tests. We've probably avoided blood work almost at every visit that we have because they don't connect the blood work. So, I mean, it's thousands of dollars, I'm not sure. And then we found a solution we get her medications actually in pre-made bubble packs that I just found the solution, and that saves us $300 a year, and it delivers them in pre-dosed punch-out packs. So it makes it easier for her to take her medications, and it saves us money. So definitely being engaged also does have a financial impact. I'm not sure exactly how much, but. Any other questions? Okay. Well, I certainly share things as much as I can on social media. I write at least an annual post kind of what we've learned over our journey. And so So I've shared some of that stuff on my personal blog and on Twitter. We also share a lot in our Cure Jam group, but that's a private group. Obviously, I built a company with some other people on called CareSync. That's mainly what we're trying to do, is make it easier for patients and make them have meaningful information. So that's trying to give back to the community and make it an easier process.
Every state has its own regulation for pediatrics and access to data. 12 and 13 is often a barrier. Notice all this data issues with.
Yes, so I'm glad you raised that, actually. So some of the organizations that she's seen in won't allow me to even have a portal login because she's 16, but they'll allow us to get paper records, but then they charge us $1 a page to get those records. But that's one of the things that CareSync actually does, is we get the records even if they're on paper, and then we digitize them for people. So that's one of the ways that we worked around that, because they have a process in place to manage it for paper, but they haven't figured out the processes to splice the digital data yet. That's what they tell me anyway, why it's that way.
I'm just wondering if you could tell us what you found, what you're doing with Morgan here to help her become and word is you're going up and becoming more responsible. How you will become.
So that's a great question. So one of the things we started doing when Morgan was first diagnosed is on the way to each visit, we would ask her, okay, what are you feeling? Think about how you're, because they ask you so many questions at ready fire, but if you're not prepared and haven't thought about it, it's kind of difficult to answer. So especially like pain, they ask her how she's feeling. Well, when you're 11 or 12 or even 16 and they say, how are you feeling? You remember the last week, but maybe not the last month or 2 months. So we started kind of paying attention to that more and prepping her to think about it before the answers. And now she's pretty good at obviously telling she's older. But I'm not sure if you've seen her on YouTube, but she actually started her own YouTube channel and blog speaking out about patient experience. So she's well on her way to being, she's very outspoken. But it is an important, you have to teach people, actually, to quote Morgan, she said, you send people to medical school to become doctors, but you don't send people to patient school to become a patient. So it is very important to teach them. Yes. Not yet. Thank you.
I'm sure you've heard from Amy sort of the trials how challenging it could be to provide care for your family. I'm going to switch modes a little bit, and we're going to talk to Dr. Josh Reicher. He is a third-year radiology resident here at Stanford who has authored many articles surrounding patient engagement, and also in innovation in breast care, as well as mammography imaging. And during his residency, he also co-founded a company focusing on secure health communication for patients so that they can be involved in their care. So we want to hear more about Josh's journey through developing such a program during residency and his perspective on managing patients through not only a physician's perspective, but engaging with patients and helping them to get access to their care.